Today, I want to do a part 2 to that vaginal sizes cast situation. And I kind of want to meld it with like proper vaginal exams and just understanding like your body in that way. First of all, I think it's important for anybody to look and see their body. I really do. Hold that thought. I will tell you more about that in a second. But I think that the way that they did these casts, first of all, they were on humans. They were on like live humans. There's a lot of comments on this video like they were done on cadavers and all that. No, these were people, humans that were walked in, signed up to not only have casts of their vulva done, and then they also had these like poured in casts of their vagina made. And so they put this plaster in the vagina and filled it to capacity. Hello, everybody. It is me again, Dr. Wendy, aka Dr. Every Woman, and we are here to take off the white coat. Today, I want to do a part 2 to that vaginal sizes cast situation. And I kind of want to meld it with like proper vaginal exams and just understanding like your body in that way. First of all, I think it's important for anybody to look and see their body. I really do. Hold that thought. I will tell you more about that in a second. But I think that the way that they did these casts, first of all, they were on humans. They were on like live humans. There's a lot of comments on this video like they were done on cadavers and all that. No, these were people, humans that were walked in, signed up to not only have casts of their vulva done, and then they also had these like poured in casts of their vagina made. And so they put this plaster in the vagina and filled it to capacity, which is important, I think, because we think about the vagina as like a closed space, and it is, but it can be distended. And so different people's vaginas are longer or shorter, wider or less wide. And when they distended it all the way out, that was the shape that it came to. And then they were able to pull it out because the vagina is a dynamic place. This is how babies come out of there. How do you think you can push a butterball out of the vagina? It is a place that changes, and it has stretch potential, and it is able to kind of mold. And so they were able to fill the vagina with this plaster, let it harden to a degree, and then lube and pull it out in order to see what the different shapes and sizes of vagina are. And that's, I think, why so many people have challenges when it comes to vaginal exams and like speculum exams, because I don't honestly think that everyone is taught very well how to do a vaginal exam. So for me, it's important that I go in the vagina with the speculum carefully, and I like look for the cervix without even opening the speculum. So essentially, I will carefully say, this is my speculum, right? So I carefully, with the speculum, I insert it into the vagina, and I'm looking for the cervix kind of carefully, moving very slowly and very carefully. And once I see the cervix, I open very slightly in order to get enough view of the cervix to either do the PAP or to do the STI screening or whatnot. But the idea is that the vagina is a potential space, and it does have kind of like twists and turns a little bit, and various people's vaginas are different sizes. I've definitely seen people who just go into the vagina and open the speculum all the way, and they're looking for the cervix. And that's uncomfortable. So first of all, to any healthcare provider out there, be slow, be careful, and don't just open the speculum. Don't just do it. Open it very slightly, because that's what causes discomfort. That's what makes people not want to come back. So, I think that this video is really important for us to all know, like, our vagina is not like just this little bitty thing. Most people's vaginas, like, there are kind of spaces and sizes, and there is a little bit of a pathway that one has to get to the cervix. Everyone's cervix is in a different place. I want to show you one quick thing before we wrap this video, because, to me, this is important. Again, gynecologist here, you know that about me. Seeing your parts, I think, is like an important thing for any human, including a human with a vagina. So I have my mirror, my EveryView mirror, that I use to look and inspect. You open it up, change the position to like a C, and I turn on my light. This light is kind of, subtle enough. And then it's got a magnifying mirror. So I can literally change my angle so I can look down here, and I can see with my eye, if I look here or here, I can see this mirror, and I can see everything about myself, okay? I think that's important. I think it's important to teach our youth. I think it's important for us to know for ourselves what things look like, because if something were to change, you need to know that. Like vulvar cancers, melanoma, all that can happen down there. Or even just STIs, or even just like ingrown hairs. Like, you should know what's happening peri-vulva, peri-anal, your back, your head. You can look at anything with this. So that's just a shameless plug, but I think it's a healthy plug because, you know, knowing your body is like the least I think that any individual can do for themselves. So I hope this helps. Like, subscribe, drop any questions in the comments, tell a friend, and as always, visit your friendly, local gynecologist. Bye.